The aim of this project is to develop a successful 4-week training program based on the back squat, which is our chosen motor skill. We have applied theories and research findings from the lecture content to this skill to model teaching, coaching, and ultimately improve motor performance.
Come on! Yeah! Right feet, baby! Yeah! 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 All right, right feet! Yeah, buddy! Yeah!
The back squat requires feet flat on the floor, shoulder width apart. The individual starts in an extended anatomical position. The spine should be straight and upright and knees and hips neutral. The first movement begins with the descent phase where the hips, knees and ankles flex. Thighs should be at least parallel with the ground and the hip joint should be at level with or slightly below the knee joint. When extending back up to starting position, it should be performed through a triple extension of the hips, knees and ankles. Posture should remain in an upright position to support the posterior torso muscles. Head should remain still with eyes looking forward. Chest should be held high with shoulder blades retracted.
Gentile's two-dimensional skill classification system indicates the back squat as stationary with intertrial, where there is body stability and transport with object manipulation.
We classified the back squat as a gross motor skill as it is a multi-joint movement requiring large muscle groups. The back squat is classified as a discrete skill due to it having a fixed beginning and end point, unlike swimming which flows on for several minutes or a gymnastics routine that involves a series of discrete movements. The back squat is classified as a closed skill as it is in a predictable environment and the response is planned, whereas an open skill is variable and unpredictable during the action. Augmented feedback helped achieve retention of the back squat. We could identify that learning had occurred by monitoring the difference in performance measures between the pre-performance and post-performance. As well as receiving information from an external source, the training program also helped in the transfer of skill development. A qualitative measure of the performance that we assessed for our skill was the technique of the back squat, in which we focused on the actions and specific movement pattern that is required to achieve correct form. We monitored and improved technique by using cues and incorporating skills similar to the back squat in our training program. For our quantitative measure of performance, we focused on how many reps could be achieved in 30 seconds. The initial performance of the back squat, I was only able to achieve 11 reps in 30 seconds, and my technique that was observed was poor. It was clear my performance had many issues. My squat depth was incorrect as my thighs were not parallel with the ground, and my eyes were focusing on the floor, which disengaged my posture. Another issue was my stance, as I failed to squat with my feet at shoulder width apart, which also played a role in inhibiting my performance. The post-performance, however, showed a significant improvement on both technique and the number of squats recorded in 30 seconds. As a result of the training program that we designed and the focus we had on training cues and feedback, I was able to build strength and better understand the technique that this skill required. The outcomes supported our predictions, which were improved technique and increased reps in 30 seconds. Through observing the improved technique and increased number of reps performed in 30 seconds in the post-performance of the back squat, we can identify that the skill has become automatic and attention can now be directed elsewhere, such as increasing weight on the bar. In this autonomous stage, learning now becomes slow, there is fewer errors during performance which we can see in the post-film, and there is now the ability to perform the correct movement in a variety of different movement situations.
The aim of the training program was to prescribe various exercises that would improve skill acquisition and the development of the back squat. Sessions were completed 3 times per week with various exercises completed in the program. Progression was implemented during the program. The first 2 weeks, the subject completed 3 sets of 10 repetitions per exercise, whereas in the last 2 weeks, 4 sets of 12 reps was prescribed.
Was minimal. As the program progresses, the memory of the skill improves and the movements become more natural and applied more frequently throughout the training program. There is evidence that directing attention externally to the effect of the movement on the environment improves performance compared to focusing internally on bodily movements involved in the execution of the motor skill. The attention of the participant was high at the start of the program as the exercise was new and unlearned. Demonstration can be used to capture the attention of the learner if they seem disinterested or unmotivated. As the participant was taught the skill and training to perform the skill at their peak, their attention faded away as it became more of a natural skill to perform. They were not focusing on how to particularly perform the skill, they were rather just doing it. Research suggests that focusing externally is optimal for motor learning and skill performance, although there is some debate about experts compared to novices. Focusing on not overloading nor overwhelming our participant, we carefully considered goals that were not unachievable or out of the reach of our new learner. The overall goal was not out of the participant's reach, it was clearly defined and able to be measured in a pre- and post-training test. Other goals could include improvement in strength, increase the weight of the bar, and increase the participant's range of motion. The goal-setting process helps athletes understand where they are currently and also where they want to go. Our training program consists of teaching the proper technique of a back squat. To keep our participant motivated and engaged, we added a variety of exercises that were specific to improving the participant's strength, power, and strength endurance to be able to perform better on the post-test and reach their overall goal. We used the front squats, back squats, leg press, calf raises, kettlebell squats, squat extensions, hamstring curls, alternating lunges, and overhead squats as part of our training program. Week 1 focuses on basic movements, and as the weeks progressed, the movements increased slightly in complexity. There was a mix of whole body movements such as squats and accessory exercises such as leg extension and leg presses to help reduce overall fatigue and focus on the specific movement patterns and elements of the lift. All tests and training sessions were performed in the same setting, the ACU gym. The environment setting was comfortable for our participant and they were able to feel confident in stepping into a training session. Our attention to necessary information encourages self-talk and shows a strong cognitive representation. Verbal cues can also have a negative influence if they are providing too much information at once. Confusing terminology can also be overwhelming for the participant. To avoid this, we kept the terminology basic. The skill needs to be performed correctly by the demonstrator to be most effective. Demonstration should precede practice and the instructor should continue to demonstrate during practice as frequently as necessary.
Augmented feedback was provided throughout the program. Augmented feedback is defined as feedback received by the subject from their social surroundings either during or after performing a skill. For example, the subject received visual and auditory stimulus from the coach in relation to technique. As the subject transferred through the FIT's 3 stages of learning process, the amount of augmented feedback provided gradually decreased. This is due to increased competency levels and the ability to detect errors in performance. There are 2 types of augmented feedback, knowledge of response and knowledge of performance. Knowledge of response refers to information about the outcome of the performance or accomplishment of the goal. This type of feedback was not used as it does not promote learning. The second type of augmented feedback, known as knowledge of performance, was used throughout the training program. This refers to information about the key movement patterns of the back squat that lead to the performance outcome. For example, in week 1 the subject squatted with the hunched back, resulting in decreased range of motion. This is when the coach would provide short, sharp and concise auditory feedback relating to this skill and demonstrate the correct technique. For example, look at the ceiling in front of you and keep your back straight. A combination of concurrent and terminal feedback was used throughout the training program to maximize learning and skill progression. For example, during the program the participant was told to look at the ceiling, and once the exercise was completed the subject was told what went well and what did not go well. The phased schedule approach was used during the program. This relates to feedback becoming less apparent as the training program progresses. This aims to avoid the guidance hypothesis where the participant relies on feedback to perform the skill. The contextual interference effect was used throughout the training program. The movement of the back squat was broken down into key stages. The participant was practicing the whole squat motion from week 1, and accessory movements were also incorporated throughout the whole program. This is when the subject would practice specific movement phases of the squat, also known as part practice. Specificity of practice was implemented, meaning the exercises prescribed in the training program mirror the key movement patterns of a back squat. Distribution of practice refers to the structure of training, specifically frequency and duration. Distributed practice was used for our training program, meaning session length was short and more frequent with long rest duration. 3 sessions per week lasting 30 minutes with 60 seconds rest between sets and exercises was prescribed. The back squat is classified as high in complexity and low in organisation, therefore a combination of whole and part practice was completed. Whole practice was incorporated into the program, however due to the high degree of fatigue caused by this skill, approximately half of the session was whole practice. Part practice training was also utilised throughout the program as a means of reducing fatigue due to the high physical demands associated with lower body resistance training. The purpose of part practice is to break down the movement patterns of a back squat and practice specific movements to enhance the overall. Variability refers to the variety of a movement. Due to the skill classification of the back squat, various methods for implementing practice variability were utilised. The use of machines, kettlebells, barbells, weight plates and bodyweight exercises. The training program was structured to ensure the more complex and physically demanding exercises were completed at the beginning of the workout, followed by isolated exercises. Progression was implemented to maintain attention and motivation of the subject. This included increased weight, increased repetitions, and an increase in the complexity of exercises. The overall aim of the study was achieved. There was an evident improvement in both qualitative and quantitative results after the implementation of motor control theories in conjunction with the completion of the training program.